I'm Gail Miller from Aged Care Explained. Welcome to my Aged Care Mythbuster series. Today we're busting Aged Care myth number 12, and it's that I'll find the right home when I need it for mum. That's possibly not going to be as easy as it sounds. When mum needs it, we'll probably be in the middle of a crisis, which will be a stroke, broken bone, heart attack, or potential dementia issues. That is not the best time to be making sensible, logical decisions or to be having to learn a new process. The whole aged care services process, whether it's in-home or residential aged care, is actually quite complicated. So whatever preparation can be done before a crisis, like I've got my thing up here, don't wait till the wheels fall off. If you can do some preparation beforehand, that will be fantastic. People need to consider how much time can you afford to take off work. I spoke with a family the other day, and one of the family members couldn't be there because if she takes any more time off work to try and help sort her parent out, she risks losing her job. That would just compound the issues even further. There's never really a convenient time to be trying to deal with aged care issues. So it's a time-consuming process to learn. As fast as you could learn it, the guidelines change, and so you might only ever need to do this once, but if you had to do it for two parents, chances are it will have changed by the time you get to the second one. Then there's the time to do the paperwork. Every home has a different set of paperwork. So that's time consuming. I had to fill out 6 different lots of paperwork for my mother-in-law. The Centrelink paperwork has 155 questions. If you get one question wrong and the application's rejected, it goes back by 6 weeks every time. So that's a time consuming and convoluted process. An aged care placement consultant can do that process in their sleep. So I help families anywhere in Australia who need help for their parents, or I can help people anywhere in the world who've got parents in Australia to find the right professional for their needs. Even with an aged care placement consultant, it's not a one-size-fits-all. You know, sometimes I'll have in my mind who I'm actually going to refer a family to. Then they throw in some medical issue and I think, that's not the right placement consultant. I need to send them to this particular person who has a clinical nursing background. So I listen very carefully to what families are telling me and then work out who to send them to. With one family that I met with, I gave them an action plan with 6 different steps on it. Normally an action plan only has 4, but for this family I gave them 6. They sent me an email about 3 weeks later and they had actually actioned 11 things because they'd listened really carefully to everything we discussed. You know, they'd gone and registered as third-party authorities with the doctor. They'd bought a dementia clock, as I had suggested, and a whole host of other things because they'd listened carefully to what I was saying and they took action before there was a crisis. It's great meeting with those sort of families. Stay tuned and we'll bust aged care myth number 13 very shortly.